much. Thank you. James Davis.
Thank you, Chair. Professor Dawson, I'm keen to return to the issue of the NHS staff survey. Clearly, it throws up some pretty alarming statistics. We've seen some of that reflected in what we've heard today. I see it in my own MP post bag, but nevertheless, I'm keen to understand how representative it is. Do you have an idea as to the proportion of the NHS workforce that takes part, and also the settings, the workplace settings that perhaps form the majority of respondents? And I ask that as someone who's worked in the NHS for 16 years, and I don't think I've completed it, or particularly remember having been asked to complete it. And when I speak to colleagues, they either don't know anything about it or didn't see the point. Thank you.
So yes, it is a sample that is done in many organisations. Actually, in recent years, a lot of organisations have moved to a census. So in lots of trusts, everyone should have the opportunity to participate in it. But even when it was at its smallest sample, the number of staff participating each year was around 200,000. So representing well over 10%, getting on towards 20% of the workforce, and more recently that has been getting up closer towards 40 to 50% who are invited to take part at least. And those who respond, the response rate has been around about the 50% mark. So it's impossible to say it's completely representative, as any survey is. It will always have its flaws in terms of the methodology. But the work that we've done, and others have done in terms of seeing who responds, there is a slight bias in terms of those staff groups who are more likely to be working at a desk, which is not surprising, but it's only slight. So actually the difference between the highest responding staff group, which is, say, the admin and clerical staff, and the nurses, for example, is only a few percentage points.
Thank you. So it is targeted. It's not a free-for-all. It's not something every member of staff can participate in every year.
It depends on the individual trust as to what their preference is there. In some trusts, it's targeted. In some trusts, they ask everyone.
Okay, thank you. And in terms of increasing participation, do you think there's the possibility that perhaps there could be more feedback to those taking part in it, or is there a case whereby perhaps concerning revelations could be addressed as a consequence where currently they aren't, or is it completely anonymised?
It is anonymised in the sense that it won't be reported who says what, and in fact no one within an organisation, within the NHS, will be able to identify any particular responses. But there are certainly information about which department people work in, for example, which staff group, so that there can be targeted response there. More can be done in terms of feeding back. This has been something which the NHS has been working on constantly since the survey started. And the survey cycle is quite a long thing, as you would expect with a large organisation like this, which makes it hard to do that. The gap between the survey results being reported and the next cycle starting is actually quite short. But I do think there could be more done which feeds that back, yes.
So in terms of addressing concerns raised, it's a bit of a postcode lottery, perhaps, depending on which trust receives the data and who acts on it.
That's right. All trusts receive a good amount of feedback. The way in which they act on that is up to the individual leadership of those trusts. And a lot of them do it very well, but the cycle is quite slow.
Okay, thank you. And finally, in terms of other disciplines, other workplaces such as the teaching profession, is there anything similar that you can compare to? I know this has been raised earlier in the session to a degree, but are there surveys of this magnitude elsewhere that provide interesting comparison?
The short answer to that is no, at least not regular annual surveys. Occasionally, a large workforce will do a one-off survey, but as far as I'm aware, this is the only survey of its kind, not only in the country, but also in the world.
Okay, thank you.
Thank you.